Good day, everybody. Today, I will be talking about childhood TB. Dito sa Pilipinas, like most of the third world countries, we have many patients with TB. Especially in children, it can be a very devastating disease, as we will see. Most of the times, we'd like to be sure of the diagnosis. Usually, it starts without definite symptoms like fatigue or dali makapoy, low-grade fever, wala gana sa pagkaon, weight loss, or poor weight gain. Sometimes, they may have night sweats na ginapamalhas sila sa gabi maski tugnaw. TB is caused by a bacteria called Mycobacterium tuberculosis and usually most common in the lungs. Outside the lungs, TB of the cervical lymph nodes called scrofula is also common. Usually, may pagadlay kita sa liog. However, we should remember that cervical lymph nodes are physiologically enlarged to a little degree in children, usually up to 10 years of age. And this can be caused also by other bacteria, which is not tuberculosis. So it can be from infection caused by bacteria from carious teeth with abscess, from other respiratory infections, or from a tumor. TB bacteria may also infect the brain, like a tuberculoma or an abscess caused by the TB bacilli, which happens usually in children younger than 10 years old. It may cause TB meningitis, which affects the covering of the brain, which may cause hydrocephalus. And this may result in devastating neurological effects leading to paralysis and severe mental retardation. TB of the bones and joints may occur in children, and most commonly affected areas are the weight-bearing bones and joints, like the hips, knees, and ankles, especially the vertebrae that make up the spines, called Pott's disease, leading to kyphosis, or ang mga buktot. TB may also infect the gastrointestinal tract, the liver, and the intestines, and may affect the kidneys also. These are usually rare, but in the past almost 28 years that I've been here, I have seen this in our very poor communities here in Bacolod. TB may also affect the middle ear with perforation of the eardrum and pus coming out of the ear, and that does not respond to our regular antibiotics.